So today I'm going to be talking about the chemical chlordane. Chlordane is listed as chemical number 22 on the substance priority list provided by the Agency for Toxic Substances and Disease Registry. In this video, I will be talking about the background of the chemical, its chemical structure, its regulations, pharmacokinetics, pharmacodynamics, industrial exposure examples, examples of chlordane exposure cases, and its interaction with the environment. Chlordane is a man-made organochlorine compound that was popularly used from 1948 to 1988 as a pesticide. Sometimes called by its trade name octochlor and Velcicol 1068, chlordane is a mixture of related chemicals, some of which include trans-chlordane, cis-chlordane, beta-chlordane, heptachlor, and trans-nonachlor. It can be identified as a thick liquid that ranges from being colorless to amber depending on the purity of the substance. As for its smell, it typically does not have a smell or will be mild. Like I said previously, this was used as a pesticide, so in order for it to be sprayed, it would need to be combined with water and emulsifiers, since chlordane does not naturally dissolve in water. Before 1978, it was used as a fumigating agent on agricultural crops, lawns, and gardens. However, years later, it showed concerns for cancer risk. The EPA later canceled the use of chlordanes on crops for controlling termites because tests showed that those being exposed had chemical buildup in their body fat. Chlordane was still frequently used in about 30 million homes in the United States for termite treatment from 1938 to 1988, where homeowners would apply the chemical under the home's foundation in order to kill termites, which it did well. This was until it was banned in 1988 for being a tumor promoter. So throughout time, chlordane has been known to be harmful. However, there are many things that determine the severity of health problems. Those include the dose, the duration of exposure, the route it was exposed, whether it be eating, drinking, breathing, or skin contact, other possible chemical exposures with chlordane, and individual characteristics like age, gender, family traits, and lifestyles. Its chemical structure is C10H6Cl8, which include the elements carbon, hydrogen, and chlorine, and considered to be an irritant, health hazard, and environmental hazard according to PubChem. Although it was canceled for use, it is still commonly used as a pesticide against termites in many parts of the world. Due to this, there are regulations on the levels of exposure. OSHA has clear regulations on the levels of chlordane exposure in the workplace, with the maximum amount of allowable exposure in the air to be 0.5 milligrams per meter cubed for those exposed 8 hours per day. Factories are able to release chlordane into the environment according to federal regulation. However, for spills or releases that are over 1 pound will need to be reported. Drinking water should not contain more than 2 parts per billion for adults that are drunk for long periods or regularly. Now onto the more important stuff. Chlordane is a chemical that is highly lipophilic and readily absorbed through most routes of exposure. Like in the problems seen in its early use, the chemical primarily attaches to fat where they will be able to sit for very long periods of time. During absorption, chlordane can easily be absorbed through the respiratory tract, which are indicated by the blood and tissue levels depending on the amount of exposure. A large majority of the data regarding consumption of chlordane is accidental. In these cases, after consumption, there has been evidence of chlordane being found in blood plasma and a variety of tissues throughout the body. And in some cases, levels in fat and livers have been reported to be greater than those in the blood, which can be even more harmful. As in the case of many drugs, chlordane was tested on animals to gain a better understanding on how it works. After rats had been exposed and chlordane was absorbed into the gastrointestinal tract, the chlordane showed peak blood levels between 2 to 24 hours after exposure. Then after this time period, it was likely to be excreted in large amounts and eliminated. During these tests, researchers also reported that severity varied depending on medium. As animal testing has shown, rats will show signs of higher levels if they are exposed to chlordane in an oil form. However, not much research has been done in regards to humans and their effects. Chlordane can most easily be excreted through bile rather than urine due to its high lipophilicity, and large amounts can also be released during lactation. But overall, metabolism of chlordane is very limited, and similar patterns were seen whether it is a cis or trans isomer. A large number of those being affected by chlordane come from those who specifically work with the chemical. There have been several cases that those who work in the manufacturing of insecticides like Chlordane are highly likely to be exposed through skin contact and inhalation. Because it is created as a spray for termites in agricultural use, the tiny particles can easily make their way into a worker's airways or land on their exposed skin. Over decades, there have been many reports of chlordane exposure effects on industrial workers. In one of the cases, a 47-year-old man was exposed working as a nurseryman, a commonplace for pesticides. Having been exposed for over 1 year at this job, he experienced seizures, EEG cerebral dysrhythmia, convulsions, and twitching, up until he was removed from the environment. However, in some cases, there have been tests done that show no signs of any effects. In the reports of those who work in plants with chlordane manufacturing for several years, no effect was noticed. Some of these tests include chest x-rays, urinary dilution and concentration tests, blood counts, routine urinalysis, and hemoglobin measurements. In addition to industrial exposures, there are many cases, especially in the mid-1900s. Here are a few cases, most of which have affected small children who are more likely to be severely affected by chemical exposures. Both in the year 1969, a 4-year-old girl and a 20-month-old boy were reported to have accidentally ingested chlordane, which resulted in intermittent convulsions, loss of coordination, and increased excitability in the girl, and vomiting and short interrupted seizures for the boy. In another case in the 70s, a hospital reported several cases within the same year of children being affected by chlordane. 14 of those children were diagnosed with neuroblastoma, 3 cases of aplastic anemia, and 3 cases of acute leukemia, each reported to have been due to the chemical exposure. In each case, the child or their mother had been living in a home that was termite infested and treated with chlordane. Some chronic effects include those to the nervous system, and based on ongoing research has the possibility of affecting non-Hodgkin's lymphoma rates. Its acute effects are more numerous, which include gastrointestinal distress and neurological symptoms like tremors and convulsions. Moving on to how chlordane works in the environment, as I mentioned earlier, although it is no longer used in the United States, it is still common in other countries. Since this chemical is most often used as a liquid, it can easily make its way into soil. In the soil, it will attach to particles on the upper layers of the soil and not likely enter the groundwater, and approximately half of the solution will evaporate when applied to the surface of the soil, which is a positive for reducing exposures. We are still unsure if it breaks down in soils, and it has shown to be persistent, especially in heavy, clay, or organic soils, than it would be in sandy. Although not seen in soil, chlordane breaks down by reacting with light and other present chemicals in the atmosphere. As mentioned, it does break down, but is still long-lived and will often travel long distances and be deposited on land or in water far from its original source. Because of this, chlordane and the chemicals that make up chlordane are able to accumulate in fish, birds, and mammals, as it stays in the environment for many years and found in food, air, water, and soil, which is why chlordane is still commonly found in some form in the fat of fish, birds, mammals, and almost all humans. Okay, that's all for now, so here are my citations.